Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts. Today's topic is family and cosmetic dentistry, and joining us today to talk about this is Dr. Ray Jarvis with Restoration Dental Group. Thanks for being here.
Yeah, I'm very excited.
Absolutely. So this is your first Healthline.
Yeah.
So really happy to have you as our dental expert. So tell us a little bit about what you do as a dentist.
Yeah, so I've been in practice here in Shreveport for about 14 years. Got out of dental school back in 2010 from New Orleans. And so yeah, we run a very nice general and cosmetic dental practice where we see patients of all ages here in town. And so it's been a lot of fun taking care of lots of families from age, 2 to 102.
Okay.
So, yeah.
Love it. So you kind of cover all the things when it comes to teeth and taking care of them. And you even mentioned like cosmetic as well, so maybe teeth whitening.
Certainly.
Okay.
Yeah, so it can start at teeth whitening, and depending on what the patient wants, it's very fun to get patients comfortable with their smile to where they can love the way that they look. The way their teeth look brings a lot of confidence to that person. So definitely starts with teeth whitening. Some people need something as easy as maybe some cosmetic bondings, like a tooth-colored filling to make their teeth look more natural, all the way up to porcelain veneers and sometimes full mouth crowns, depending on where we're starting. So
okay, very cool. So what made you decide to be a dentist? What was your inspiration behind that?
So in high school, I had a mentor that's a dentist who I ended up practicing with for the first part of my career, Dr. Ron Crawford. And so just kind of learned about what he did and really got interested in it. At the time, I was thinking about going to medical school or becoming a scientist or something along those lines.
Cool.
And had always enjoyed working with my hands and building things, and always was good in science and math. And I didn't enjoy studying English and history as much, and so I wanted to find a college major where I could focus on those things. And I just kind of stuck with it and just fell in love with it along the way, and all worked out. So I really enjoyed it, yeah.
Really cool. Yeah, and now you have your practice here, so that's awesome. Okay, so we are talking about also just how to take care of your teeth too. So, brushing your teeth morning and night, I'm sure that's something that you would suggest doing, but flossing as well, right?
So what I try to stress with patients is, just try to devote 4 or 5 minutes a day to focusing on your teeth. And not just brushing your teeth, making sure you're brushing them correctly. A lot of people just brush their teeth thinking about something else, thinking about their day coming up or what they have going on, but being very particular about how you brush your teeth can make a big difference, for sure. So spending a full 2 minutes brushing in the morning and at night, and then flossing before or after, and there's a very specific way that everyone should floss too. So, and we're here to teach you that. Definitely myself and Dr. Patton and all of our dental hygienists do a very good job, make sure everyone knows how to take care of their teeth for sure.
Yeah, okay. And there's also a specific way that you want to brush, right? So you're not hurting your gums and things like that, right?
Yeah.
Can you talk a little bit more about that?
Brushing along your gum lines is probably the most important area that you need to brush correctly. You can definitely brush in a way that may damage your gum tissue, but also make sure you are brushing there, because that's a very common place for plaque to build up and cause cavities. Some people only brush kind of on the chewing surface, not thinking about where all they need to move the toothbrush, but being really intentional about where you brush your teeth and how you floss to make sure you get all the plaque off of there.
Okay, is there a specific way that we should be flossing?
So I say definitely. So when you have the floss around your fingers, some people will just may go up and then down, but you really got to look in the mirror and make sure you're bringing the floss past the gum line on both teeth in each contact. And so you can really see where some people just stop short of where your gums are, but the floss actually needs to go a little bit past that, so you get the plaque that builds up below your gum line. That's the most important part of it. And that's what you're trying to do when you're floss, is get the areas that you can't get to with a toothbrush. Right,
exactly. And those are usually probably the biggest reasons why you would probably see cavities in patients, you think?
For sure. The reason we take dental x-rays, for instance, when a patient comes in, is there's areas of the teeth that we can't see just from looking in a patient's mouth. And so definitely the areas where you're flossing, those are the places that can develop tooth decay that we find on these x-rays. For sure.
Gotcha. Okay. Yeah, really important stuff. So we did mention this in our midday newscast that some people get a little nervous when it comes to, going to the dentist. So what would you tell someone that's watching to put them at ease?
Sure. Yeah, no, I try to meet the patient where they're at. Like I said before, we can use things like nitrous oxide. That's a gas that can help people relax a little bit. There's other ways that we can help them out. Just remind them that these are usually very small procedures, very short procedures. We want to make sure that the patient is completely anesthetized. Each tooth is fully numb before we work on it. Try to make them sure that, I'm going to make sure that you're not going to feel this tooth when we're doing whatever procedure we need to. So yeah, we do all we can to keep our patients comfortable. If they ever feel like today in the day and they're kind of too nervous, we can always kind of reschedule and kind of see what we need to do to change next time.
Okay. Yep. Yeah, that's really helpful, I'm sure, for some people that just feel really apprehensive, because it's so important, as you mentioned, to go and get your teeth cleaned. I think you mentioned twice a year is what you recommend, right?
Certainly, yeah, twice a year is certainly the best. Some people can go a little bit longer than that, but most of the time, there's a reason we have dental hygienists is because there are parts of your teeth that build up calculus or plaque that you can't always clean off on your own. And so we certainly have dental hygienists to take care of those things in those areas you can't quite reach quite right. And we always try to catch issues in people's mouths before they get too big. As they get bigger and bigger, the procedures become more complicated, more work needs to be done on the teeth, and if we catch it within a 6-month period, usually we can take care of it without too much issue.
Right, yeah, and just kind of going to see regular checkups can really help so you can catch those types
Certainly,
of things.
and those twice a year cleanings also prevents problems from occurring too.
Okay.
And definitely, studies have shown people that go to the dentist twice a year definitely keep their teeth much longer than those patients that may only come in when they have a problem.
Right.
Toothache comes up or they broke a tooth. Definitely people that come in routinely, we, like I said, catch those things earlier and take care of them when we can. So.
Okay. Well, if you're just joining us, Healthline 3 is where we like to focus on ways to live a healthier, happier, and pain-free life. We'll be taking your calls and answering your questions live in studio today. And we're opening those phone lines right now, 318-219-4569. That number is right there on your screen if you want to give us a call and talk with our expert. We're talking about teeth and keeping your teeth healthy, maybe cosmetic things if someone's interested in that. When you do call, make sure your TV's turned all the way down so that we can hear your question. All right. So we were talking about, making sure you're going to the dentist routinely. What are some of the things that maybe you are looking for when, you see the dental hygienist, they clean your teeth, right? So then you come in and you kind of look and feel around and things like that. So what are you looking for?
Yeah, definitely. Definitely we want to make sure we first look at and greet the patient and see how they're doing that day, of course, and see if they have any things that they've felt recently that wasn't quite right. And depending on what they say, we'll look for different things. But overall, we want to look at if they've had any previous dental work done, fillings or restorations, crowns, different things like that. We want to make sure those are still in good shape. A well-done filling or a well-done crown can last a long time in someone's mouth. Though sometimes those restorations can have problems where we need to see if they need to be replaced. So we look for that. We look at the health of their gum tissue. We can tell by the color, the consistency, kind of the shape. If they have any bleeding to the cleaning, we can see if that's an issue. We also check, you may have a dentist ask you to look at your tongue. Some people are taken aback by that sometimes. We always do an oral cancer screening. Since we're the doctors looking in people's mouths all day, we're well trained on finding those small cancerous lesions. So those are all the kind of things we're looking for. And then offer answer any questions the patients may have and advise on things that they may need. Okay.
And what are you looking for when you're looking like in an oral cancer screening?
Yeah, so the most common area is the side and under the tongue, and so we have the patient stick out their tongue and kind of pull it to the side and look over there in that way. A cancerous lesion in the mouth is rare, but we do find them sometimes, and it's a painless condition usually, and so that's why we always want to look for it, is because it's usually asymptomatic until it's not, and it's a real problem. And so they can start out as these very small little white and red little ulcers. That if we find them, if the patient doesn't feel them ever, usually that means that they need to get it checked out. We usually refer to an oral surgeon or a periodontist from there, and they can kind of take it. Sometimes it's harmless, sometimes it does something that needs to be removed.
Okay, gotcha. I remember I go to my dentist every 6 months, or try to, and I had TMJ for a little while. Do you ever notice that as well?
We certainly do.
Yeah.
We treat a lot of patients with TMJ. It's one of these conditions where people have TMJ pain. Lots of different things can cause that. We definitely first start to look at their bite to make sure their teeth are aligned correctly, and your teeth can move around side to side in different ways. If certain teeth are hitting in the wrong place, that can throw off your jaw, causing some pain. Also, people have breathing issues. Sleep apnea is a big hot button topic these days. So people with moderate to mild or even severe sleep apnea also can grind their teeth, causing some tooth pain. So we look at that. And so sometimes we start with a night guard that we make, a custom-made night guard. We're very specific about how we shape those. It's not, some people want to use the over-the-counter night guards, which sometimes those are okay, but we're very specific on how we make these so that they are therapeutic to relieve and correct people's bites. But yeah, TMJ pain is very uncomfortable. People have a lot of pain with that. We're starting to use Botox to treat that a lot.
Okay.
I've had a lot of success with that. People that clench and grind their teeth a lot, not only are they damaging their teeth, but certainly can have pain in their ear and in the joint as well. Temporal headaches, we get a lot of migraine headache patients that are actually clenching and grinding their teeth. And what the Botox can do is it kind of tells those muscles to kind of
Relax.
calm down,
Chill
relax, and it doesn't allow those muscles to work quite as hard.
Okay.
You know, if you can imagine how hard you can clench your teeth during the day, when you're sleeping and all your nervous system isn't working quite the same when you're asleep, you can clench down maybe 3 and 4 times as hard.
Oh, wow.
And so the TMJ is a very powerful muscle and joint complex. And so that's where a lot of people are getting their TMJ pain from. And so TMJ pain can run the gamut of all different types of things. So.
Okay, we have our first caller.
Oh, nice.
Lee, thanks for joining us, and what's your question?
Hi, I'm calling in regards to having my teeth clean. I go, and as I go to get them clean, then I get the x-rays what my insurance company pays for. But now the dentist wants to do all this extra work, you know, several $1,000s to do whatever, and I never get my teeth cleaned. They never clean my teeth. Is there a reason behind that?
I would say definitely sometimes. If there is a severe acute condition, maybe it's an infected tooth, a tooth that needs a root canal or that has an abscess or severe tooth decay. Sometimes if patient or has severe periodontal disease where maybe someone hasn't been diagnosed with periodontal disease in the past, a lot of those things have to be taken care of first. If teeth are infected, you don't want to just clean the teeth and then not take care of those other big issues that I kind of mentioned before. So we always try to catch those beforehand. So correct. Sometimes it's not the appropriate treatment just to go in and get your teeth cleaned first. If you have some other things going on that need to be taken care of, unfortunately, that's what has to happen. Yeah. So there's an order of things that we have to take care of. For sure. So that may be what's going on, you know, without seeing your x-rays, tough to say. But sometimes, like I said before, it's interesting. A tooth that's infected sometimes causes a lot of pain. Other times it can be an asymptomatic condition where you have this infection around a tooth that's just lurking there for years sometimes, and the patient doesn't know about it until they go to the dentist and see the x-ray. And so certainly want to take care of those things, get your teeth healthy, and then work on just cleaning your teeth from there.
Yeah. All right, thanks, Lee.
Okay, and where are you located in Shreveport?
Yeah, good question. We are on Fern Avenue between Burke Coons and 70th. I don't think the address is 7607 Fern Avenue, and so it's right there, kind of by the auto mall and all that stuff. So it's been a good spot. It's central to a lot of Shreveporters.
Thank you so much.
Do you have a phone number that people can call that would be, you know?
Absolutely. Yeah, you can call 318-797-1181.
It's right there on your screen.
Yeah, so that's us, and we have really enjoyed being a dentist here in Shreveport and taking care of the people in your hometown. So.
All right, good deal. Thanks, Lee, for giving us a call and for that question. If you're just joining us and you have a question, that number is right there on your screen, 318-219-4569. We're talking about all things dental. You know, any of your questions about your teeth, if you have any tooth pain or anything Am I missing anything? Cosmetic things?
Yeah, certainly. Patients come in and think they just need their teeth whitened, and a lot of times that does a great job of getting people's teeth looking a lot healthier and beautiful, and people can love their smile that way. Sometimes it takes a little bit more work, whether they have to see an orthodontist first. That happens a lot of times. To get the teeth in the right position. Before I would want to do a set of veneers or set of crowns. If the teeth are not positioned right, you're going to damage those expensive veneers without putting the teeth in the right place. And so that's why it definitely takes a comprehensive exam to see what all you have going on. And
yeah. Okay. So what about? I feel like maybe a common question you get is toothpaste.
Right.
What do you recommend as far as toothpaste?
There's of course lots of toothpaste out there. I always advise people to look for the ADA seal of acceptance. Those toothpastes have gone through rigorous testing to make sure they're not damaging to the teeth.
ADH?
Well, the American Dental Association.
Oh, ADA.
ADA.
Okay,
and so you'll
got
see
it.
that little square stamp on there. But yes, there's been lots of toothpaste out there that purport that they're whitening toothpastes or detoxifying. There are some good ones out there. But I would say it's very important to have some type of a fluoride toothpaste. I've worked in non-fluoridated communities as well as fluoridated communities and see a vast difference in the strength and how hard these teeth are and resistant to tooth decay. So I always suggest fluoridated toothpaste. You got to think people that may not want to use a fluoride toothpaste. Remember that when you're brushing with your toothpaste, you're not ingesting that toothpaste. You're going to spit it out in the sink, and so some type of fluoride toothpaste is always good. Some of the whitening toothpastes do work. They usually lightly polish your teeth a little bit more than maybe those that don't. And so I always advise people that if they're going to use a whitening toothpaste, just expect that they're mostly going to maintain the color of your teeth and not going to have this vast change. But yeah, I always say find a toothpaste that you like, the taste of it. I have to use a sensitive type toothpaste. People with that can have really teeth that are sensitive to cold or sweets. That's a very common thing. And most toothpaste brands have some type of a sensitivity type toothpaste that has another medicine in there to help kind of tame that sensitivity down. So that helps a lot too. Sensodyne, Crest Sensitivity, all the Colgate has one. There's the chemical in there, the medicine is called potassium nitrate. It does a good job of, you probably see in the commercials where it shows the tooth zoomed in and see the little tubules on the root structure. And so everybody has those. Some people's tubules are like smaller than others, and some people's tubules where the nerve is connected to is larger. And so that's when you can have a lot of root sensitivity, and those types of toothpaste can help a lot. Okay,
cool. Okay, so speaking of whitening, that's something that you offer, and typically, so for example, let's say somebody has dental insurance, your 6-month cleaning should be covered by insurance, right?
Yep.
Now, what about like the cosmetic things? Is any of that typically covered?
Usually not. That's a very common question. Maybe not daily, weekly. We get those questions. Yeah, definitely. We have lots of different types of whitening that we can do. We have some at-home treatments that are a little bit stronger than what you can buy over the counter at the drugstore. And then we have a treatment where we can make some custom-made trays that we take impressions, or actually a digital scan. We can talk about our digital scanner in other segments for sure. But we get to skip the old alginate putty impressions where it can be kind of uncomfortable. So we can take a digital impression now.
That's cool.
And make the trays from that. And so, so we can make custom trays that you can wear at home. We sell a gel that works with that's much stronger than what you can buy in the store, prescription strength. And then we have an in-office whitening treatment that we can also do. If people don't want to have to wear the trays at home, it can be kind of a new thing to your nightly routine and want to get it done as fast as they can. We also offer it that well. So, but yes, most cosmetic procedures, you'll pay for that out of pocket. Insurance isn't going to cover something like that.
So the over-the-counter like Crest whitening strips that you probably just think of when you're thinking about whitening. Yeah. Do you think that? I mean, they're probably not as
They do a good job.
Okay.
Yeah, I think the younger the patient has less color change to make, and that stain, maybe someone in their 20s, the stain isn't quite as deeply ingrained in the tooth. And so the over-the-counter white strips that you can buy, they do a good job. And I tell patients all the time, try those. Some patients can make your teeth sensitive to cold or air while you're doing that treatment. And if those over-the-counter strength strips cause a lot of sensitivity, then the prescription strength is really going to cause some sensitivity. Now, when you're done whitening, that always goes back to normal. You're not damaging the tooth in any way. But it's a good way to let people test it out to see if they get any change. If they get a little bit of change from the over-the-counter, then they can know that our stronger materials can probably do a lot more.
Yeah, okay. So I personally wear a retainer every night. I had braces in high school, but I think that's what contributed to my TMJ. I had 2 sets of braces, my jaw pops and all that. That's all unrelated, but I wear a retainer at night, and I'm
always related.
Okay. Well, yeah. Right, but it's not related to my question. So my retainer that I wear, I'm always worried that, I don't know, like I'm not cleaning it well enough. Do you think that could contribute to tooth decay since you're wearing it for like 8 to 9 hours?
Certainly, definitely. We have a lot of there's lots of different types of retainers out there now, but definitely they can get kind of gunky, I guess, if you're not cleaning them the right way. I always advise patients to have a dedicated toothbrush for their retainer, or if they're wearing a night guard, have a toothbrush for it. Because I always suggest using soap, like dish soap, to clean your retainers, or denture patients have to clean their dentures, or a night guard. You don't want to use toothpaste on like a retainer, because that can create little microscopic scratches. They're somewhat abrasive, as what a toothpaste is, to brush off the stain or brush off the plaque. But you don't want to do that to a piece of plastic, because it's going to microscopically scratch it, and then bacteria and gunk can kind of grow in it. And so you can also buy these things on Amazon or wherever. It's like an ultrasonic cleaner that people like to use those too, that keeps it clean.
I've seen that like here recently.
So they do an okay job.
And I didn't know thoughts.
But yes, if your retainer looks not good, you may just need to buy a new one. I mean, those things don't last forever. I always try to minimize my patients' expectations on something like that. The retainer, some patients can take care of them for a long time, depending on what type they are. But sometimes you have to get a new one. It's like anything else.
Okay, good tips.
Yep.
Okay, very interesting. Okay, so we talked about this, I think, earlier in our midday newscast. I don't think we've mentioned it yet now, but when the things that we eat, we live in fast food culture. We just had Halloween last week with all the sugar.
Sure.
So, and sugary drinks are everywhere. So, what would you suggest, maybe give us perspective
very good question.
On
very
how
good
that
question.
affects us?
So, tooth decay, or the clinical name is called dental caries. So, caries is the most prevalent disease in humans. Almost everybody at some point in their life is going to get a cavity. It's ubiquitous, and so if patients come in with 3 or 4 cavities on a new patient exam, we have to kind of step back and see, like, okay, what are your daily habits? What do you drink throughout the day? What type of snacks do you eat? At meal times, what are you eating? And some of the things that you may not realize can cause tooth decay really are, like crackers. Kids that eat crackers all day as a snack, thinking, you think of candy and Coca-Cola Classic, or sugary, sodas causing cavities. But things like crackers, it's made out of a carbohydrate. And so as soon as that mixes with your saliva, it becomes a sugar. And those really stick to your teeth. In the little grooves in your gums. And so being mindful, my staff will laugh that I use that word, being mindful of what you're eating every day. I always say between meals, try to stick to water as much as you can. Between meals, fruits, whole foods. I know that's a big word now, but yes, a lot of processed foods that may taste salty also can contribute to tooth decay too. Also see a lot of teenagers that are active in sports or whatnot drink energy drinks, or drink electrolyte drinks all throughout the day. Those are very acidic. And so the whole thing with tooth decay is you're demineralizing your teeth. And so you want your saliva in your mouth to have a neutral pH. I guess you can go back to chemistry class. It's either an acid or a base. So acid is going to dissolve your teeth, whereas if it's a base or a neutral, you're going to be remineralizing your teeth. And so every meal, all foods are somewhat acidic. So every meal, you're going to bring your pH in your mouth down. But you want to drink water and whatnot between the meals to get your mouth back up to a neutral pH, so your saliva actually remineralizes your teeth. If you're constantly drinking those drinks all day, you're never giving your mouth a break to keep your teeth healthy. And so being aware of those things, but correct, yes, staying away from acidic colas, acidic drinks.
Mm-hmm.
Some of the bottled waters can actually be quite acidic. That's how they kind of get them to taste better.
Okay.
And so being aware of what even bottled waters. I love tap water. It's a good thing to drink. It has here in town has fluoride in it. It's really good. But yeah, sticking to whole foods and stay away from as much of processed foods as you can. You can't stay away from all of those, but just being aware of that.
And even carbonated drinks, even if they don't have sugar, would they still
like a diet soda, right? And so those are still acidic drinks for sure. Yeah, and so very acidic, and that's why it's interesting. But that's why they taste. Why people like the way that they taste.
Yeah.
And so because they are acidic.
Well, it's crazy how we would probably reverse a lot of diseases if we changed our diet, and then also with your teeth as well. It can kind of keep it healthy if you
think about it. Like your mouth is the entry point into your body. Like everything you eat that your bloodstream absorbs starts in your mouth. And so another hot topic in just medicine in general is your gut microflora, and that can really dictate how healthy you are. Well, all that, in my opinion, a lot of that flora, all the bacteria in your stomach and your intestines comes from your mouth. And so it's very important to keep your mouth microflora very healthy. There's a lot of unhealthy bacteria that you can have in there from different habits, from different foods, and of course not getting your teeth cleaned and all that. So it can become your oral health really dictates sometimes your overall health as well.
Yeah, okay. And so when we, go to the dentist, often we get an updated x-ray. How often do you suggest getting an updated one?
If it's a patient that is mostly, healthy teeth, we at least want to get what's called a bite wing x-ray of all your back teeth once a year. That lets us look at the surface of the teeth between the contacts and below the gum line at least once a year. If it's a patient that's susceptible to getting cavities, we may do that more often. And then we also have an x-ray where we can take a picture of all the teeth at once. Sometimes we can do that every 10 years. If patients have a lot of root canals or a lot of crowns, a lot of things that we need to maintain, we take those more often than that. But definitely once a year, you need to have your teeth quickly x-rayed for sure.
Okay.
Yep.
Yeah, and what are you looking for when you're looking at those x-rays?
Yeah, so I need to bring one next time, but we'll put it up on the screen. But right, so not only are we looking at your teeth, we're looking at the bone around the teeth that hold it in place. Gum disease starts with gingivitis, where your gums are kind of red and unhealthy looking from not flossing or brushing correctly. But that can lead to what's called periodontal disease, where the bone and support structure that hold your teeth in place starts to recede a little bit. You hear the word receding gum lines, but that's also from the bone receding away that's holding your teeth in. And so that's one thing that I really want to take a look at, because it can be an asymptomatic condition that people don't realize until their teeth start to get loose from that. And so we also, of course, look for cavities and how healthy their existing crowns and fillings are.
Okay, so what about like Listerine or mouthwash? What do you think about that?
I think we're going to start seeing some different opinions about mouthwashes. I go back quickly to oral bacteria. There's good bacteria in your mouth, and of course there's bad bacteria in your mouth. Listerine's good, it freshens your breath, but I don't like people using it every day. I think it's good for certain instances. If people have a specific condition going on, periodontal disease, we have some other mouthwashes that people can use. But yeah, mouthwashes are good. But I think we're going to start seeing some mouthwashes come out maybe the next few years that are going to be more, not kill all the bacteria. Bacteria, well, it used to be a bad word. Kills 99.9% of your bacteria, which is good to keep the bad bacteria away. But there's also good bacteria in there. And so balancing that for sure.
Like your gut as well.
Yeah, exactly.
Yeah. Okay, very interesting. Well, tell us, we have about a minute left. Tell us where we can find you, phone number again, and are you accepting new patients?
Certainly, yeah, always accepting new patients. Me and Dr. Patton, who I'm sure you'll meet on another segment as time goes on. But yeah, we're on Fern Avenue at 7607 Fern in St. Beach Office Plaza. And the phone number I think was on the screen, 797-1181. And definitely we love taking care of everyone here in town and always accepting new patients for sure. Yeah.
All right, and that's your website right there,
restorationdental.co.
Got it. Okay, well, good deal. Easiest way is probably just to give you a call.
Yeah, just give us a call.
Okay. Well, Dr. Jarvis, thanks so much for joining us. Learned a lot about our pearly whites today and how to keep them healthy. And looking forward to having you back
Thank you.
and talking, maybe having your X-rays and what are you looking for.
Yeah, we can bring our scanner in here and maybe show you what all our technologies. We really worked hard to try to keep up with all the technology to make your experience as good as possible. So.
All right. Thanks, Dr. Jarvis. Thanks for joining us. This will be on ktbs.com/podcast or ktbs.com/Healthline3.